Hi, so I decided to do my psychotropic drug commercial presentation on Prozac for generalized anxiety disorder. According to Johns Hopkins, generalized anxiety disorder is described as a condition of excess worry about everyday issues and situations. It lasts longer than 6 months. In addition to feeling worried, the individual may also feel restless, fatigue, trouble concentrating, irritability, increased muscle tension, and trouble sleeping. The symptoms of generalized anxiety disorder, or GAD, are trouble falling asleep or staying asleep, trembling, twitching, tense muscles, headaches, sweating, irritability, hot flashes, lightheadedness, trouble breathing, nausea, urinating often, lump in throat, poor concentration, being easily startled, and inability to relax. Symptoms of GAD may look like other mental health conditions. This is commonly associated with depression as well. GAD usually begins in early childhood and adolescence, although it can begin in adulthood as well. It typically runs in families, although there is no official genetic link that they can find. There are many medications on the market that help with GAD, one of which is fluoxetine, which the brand name is Prozac. Prozac is one of the most commonly prescribed SSRI medications for depression and anxiety. I chose to discuss Prozac because it is very common and has good reliability in its functioning. According to drugs.com, Prozac has an average rating of 7.2 out of 10 from a total of 1,181 reviews. 65% of reviewers reported that a positive experience, while 20% reported a negative experience. GoodRx describes Prozac as a good choice for treating depression, OCD, and panic disorder. It is also less likely to make the patient sleepy in comparison to other antidepressants. It is commonly taken as a pill orally once or twice a day, or once weekly with or without food. According to medlineplus.gov, the side effects of Prozac are nervousness, anxiety, difficulty falling asleep or staying asleep, nausea, diarrhea, dry mouth, heartburn, and yawning. GAD affects 6.8 million adults, or 3.1% of the US population. However, only 43.2% of people receive treatment. These statistics came from the Anxiety Disorders Association of America. Globally, around 4% of the population experiences generalized anxiety disorders. The mean age of the onset of GAD is 31 years old. Prozac takes anywhere from 2 to 8 weeks to see improvement. Many people have thoughts when it comes to treatment, especially with anxiety and depression. Some religions are very against psychotropic medications in general. It is important to factor in the individual's needs and be respectful of their own point of view. According to an NIH study entitled Psychotropic Medication Non-Adherence and Its Association Factors Among Patients with Major Psychiatric Disorders, the psychotropic medication non-adherence for schizophrenia, major depressive disorders, and bipolar were 56%, 50%, and 44% respectively. The individual patient's behaviors, lack of social support, clinical or treatment and illness related, and health systems factor into the influences of the non-adherence towards the psychotropic medication.